Welcome to Living Yoga. My name is Darren, and today we are going to be talking about something that's not at all controversial, COVID-19 vaccines. Now, I'm just kidding. I have no doubt that my inbox will be filled with strongly worded messages after this airs, but I think this is really, really important. So I am here with a very good friend of mine. Her name is Dr. Jacki Hart, and I have known her since I was, 22 or something. Like, she's known me probably longer than anyone outside my biological family. And she is just a spectacular doctor. But one of the reasons we initially connected was she was doing research into holistic practices like massage and yoga and meditation as it relates to Western medicine, sort of the beginning of integrative medicine. And she's worked with Dean Ornish on integrative medicine. And so, Jacki, welcome.
Thanks, Aaron. Nice
I could just talk about you for days, but I just want people to know that you were doing integrative medicine before most people even knew what integrative medicine was. And so I think you're the perfect person to talk to everyone, but specifically the yoga and holistic health community about the subject of vaccines, because you do have that nuanced approach that you're not just like, go take a drug. You definitely lean into the natural as often as you can. So before we dive into COVID-19 vaccines and the litany of really hateful email that I'm about to get, I'm wondering if you could just say a little bit about yourself, the work you do, and what your current focus is as a doctor.
Okay, sure. Yeah, that's true. I mean, when I first got involved in lifestyle medicine and integrative health, which was well over 30 years ago, probably about 35 years ago, we were made fun of, truthfully. The kind of mainstream medical community thought we were kind of nuts and kind of crazy. And, I went through traditional medical school, traditional residency. A lot of times when I was in residency, people would call me and say, hey, when they were sort of reach the end of their rope with somebody with, say, cardiac disease, and say, hey, I can't offer them any more procedures, any more medications. Can you talk with them? But we were sort of thought of as on the fringe. And over the last 30 years, it's kind of been fascinating to me to watch Dr. Ornish and lots of people who had these thoughts and beliefs before others become really part of the mainstream. In fact, places like the American Heart Association and American College of Cardiology and all sorts of mainstream groups treat lifestyle medicine and integrative health as part of the standard of care. So so that is the perspective that I come from. And of course, I did go through traditional medical school and residency, so I do believe in this idea of evidence, of sort of looking at the data and information. And so so I think that gives some idea.
We have so much to cover, so I want to dive right in. And what I'd like to do is I'd like to talk about some of the, may I say, garbage that's floating around Facebook and the internet about vaccines as people consider their options. And I definitely lean into the you should get the vaccine camp. Yeah. But there's a lot of reasons why people might be hesitant or skeptical of the vaccine, and depending on their background and what they've experienced in the past. So I think some people who lean politically right have one set of reasons. Certainly people of color, especially in the African American community, might have another set of reasons. And then, of course, in what I would largely call the wellness community, yoga, meditation, massage, holistic health, all of that, I think we typically have sort of a disbelief or reasons to mistrust, quote, big pharma. We've seen a lot of drugs overprescribed and big pharma making big money and frequently harming people in the process. So what I'd love to do is I'd like to talk about some of this misinformation, but with sort of through that lens that the audience for this is probably involved in some sort of holistic medicine, which is a good thing, and probably has a distrust of Western medicine, which is sometimes a good thing, but often not a good thing. And if you could sort of speak to their unique concerns and bring in some of the other as well. Does that sound reasonable?
Yeah, absolutely. And I mean, I think you're right that like having healthy skepticism is important. And to be honest, I think, I do a lot of work with immigrants, both documented and undocumented. And as you were saying about the African American community, sort of similarly, the immigrants, both documented and undocumented, have their particular reasons for being nervous, mostly about sort of having their information or their data, kind of kept on file somewhere. Honestly, we sort of do some workarounds. I've been most confused about the holistic health community, what the concerns are, what the hesitations are, because so many of the principles actually fit with holistic health, right? Like so many of the principles of prevention, of doing not just for yourself, but for the greater good and the greater community. So I've been honestly most confused, and it makes me truthfully sort of sad because I think in theory and in principle, a lot of the people that you interface with in the world of holistic health should get it. I mean, I know that's sort of a leap can sound like a leap of faith, but again, it's been the most confusing to me.
Yeah. I couldn't agree more. I mean, especially I'm a yogi, and yoga is a vaccine. It works on the same principle as a vaccine. It's a very controlled exposure to things that stress and agitate you so that you can train yourself to respond more quickly and efficiently when it hits you in the real world. It's like the stress version and the psychological version of a vaccine. And Ayurveda, they've been doing stuff akin to vaccines for thousands of years. Right. So when I hear people say that's not yogic or that's not, like in Ayurveda, they have you eat mercury. That's not exactly what I would call sound advice. Right. And we don't question it because it comes from ancient India as opposed to, Pfizer. Right. And I think that's a bit unfair. Anyway, I digress.
Well, no, but I hadn't thought about that, honestly, Darren. And when I was just, the principles of homeopathy are really similar too, right? Like to vaccinations more broadly, more generally. I mean, the COVID vaccines don't work exactly that way, but vaccination in general often works. It's very parallel to homeopathic medicine. Yeah. So, yeah.
The Fur of the Dog That Bit You. That is the title of today's thing. The fur of the dog before it bites you is the theme of today's podcast. So first and foremost, I'm going to put this first question into like a large bucket. And that is, there are different versions of this, but something along the lines of the vaccines don't really work, or COVID-19 isn't that bad unless you're in a convalescent home, or, they're untested and unsafe. Just general like mistrust, like they were rushed out. I mean, this technology has been around for a long time. Yeah. But just the general, where you sit, are the vaccines safe and effective? And why should I get one if I am otherwise young and healthy?
So you just actually hit on about 4 different points.
Sorry.
So and I'm not sure which order I'll start in. Maybe let's start with, you're right. This technology has actually been around for decades. We just haven't, before this, found an application for it. So the idea that it's completely new is not actually true. It's been around a long time. We've just finally found a purpose for it, and moving forward, it's going to be a great platform for developing vaccines very rapidly whenever new infections arise. In terms of safety and efficacy, there were no corners, cut. The only corners that were cut was through the approval process. So there were no corners cut in terms of studying the safety and the efficacy. Safety always comes first, and then, is it working? Then you add to that, so when I say that no corners were cut, I mean, they tested it in exactly the same numbers of people than they would for a vaccine that took, years to get approved, right? So the only reason they sort of went the faster approval route is because we are in the midst of an emergency. So emergency youth authorization is just that, because you're in the midst of an emergency. We do emergency youth authorization for all kinds of things. So somebody has cancer, for example, they've sort of exhausted all quote unquote approved, treatment approaches. We make an exception and give them something that's still being studied, but the evidence is really highly supportive.
Well, let me play devil's advocate for a minute, because and I'm right there with you. But I want to play devil's advocate because I think somebody listening to you would hear a couple of things.
Okay.
First, in terms of the study, right? When it's rushed through, if I take this pill today or this vaccine today or anything today, there are the immediate safety things, like I go into anaphylactic shock because I'm allergic to it. But then there are the long-term things, like I grow unibrow or something. I don't know. There are things down the road, and we'll talk about some of the unfounded beliefs like infertility in a minute. But there's the known unknowns. Like, if I take this vaccine today, what's going to happen 10 years from now?
Right. So
it just hasn't been around long enough to know. And the one more thing, and then I'll let you run with this. And then when you compare like cancer treatment and using an experimental emergency use thing, that's someone with cancer who's probably dying and they got nothing to lose. Okay. As opposed to somebody who I'm perfectly healthy and happy and whatever, and now I'm going to take this experimental thing that could make me not healthy or happy. So run with that. I agree with you. I just want to say, I know that this is what some people are thinking.
Okay. So again, Darren, you just made like a whole bunch of points in 2 minutes.
Sorry.
No. In terms of long-term, one of the things that I was going to say is the safety and efficacy studies were not rushed in terms of numbers and amount of time. The only thing rushed was the approval process. But the other thing that I was going to add to that is that now we have people all over the world, really. I mean, certain pockets of the world more than others that, got this vaccine now almost a year ago, 6 months ago, 7 months ago, 8 months ago. Vaccines, as long as they've been around, the worst types of side effects that happen within the first week, 2 weeks, maybe month. So you can sort of feel comfortable and confident that given the millions and millions of people who have received this vaccine over time, you can add that information to the data that was sort of officially used in the studies for the EUA. So including, one of the things from COVID itself, in addition to sort of the short-term symptoms from the virus itself, which in some people may be mild, but in many people may lead to, hospitalization and ventilation. There are greater long-term risks from the virus itself, like long COVID, which we do not understand and we do not know how to treat. I mean, many of the things like yoga, meditation, nutrition, exercise, all those things seem like they have the potential to help, but we do not know. So I'm personally, and with people that I care for, I'm way more concerned about the long-term effects of the virus than I am from the vaccine. The other thing, just to go back, I just want to back up for a second because you also
Yeah.
asked what's the value, because if you put it in the context of, which I did, like approved drugs that are still under study for things like cancer and someone who may not have a long-term prognosis, and what's the benefit for healthy people. Well, what we're seeing now, and when I started with I feel sad, the more people who are not vaccinated, the more likely it is that we develop new variants. Delta variant is just one, which is now, running rampant because it happens to be, 6 or 8 times more infectious than the original form of this virus. But every time we have people who are not, the more people we have that are not vaccinated, the greater the chances are of creating more and more and more variants like that. So, anyone who wasn't at high risk for getting the original variant, well, now we're seeing the Delta variant impact people who we didn't consider at high risk for the Alpha variant, and we're seeing it impact children. So, the longer that a certain percentage of people are not vaccinated, the more likely it is to develop variants that are more infectious, like Delta is, and more virulent, so they can make even healthy people sick.
I have a follow-up question about the variants, and I want to make sure I understand something. I think I do, but I could be wrong. But before I do that, I just want to say I was talking to a friend who was hesitant about getting the vaccine, and her main concern was fertility long-term, that it may affect her ability to get pregnant down the road. And she said that we just don't know. And I said, how do you know that COVID infection won't affect your fertility down the road? I mean, I'm not saying it will. I'm just saying there's a lot of unknowns about COVID and, to be honest, the vaccines as well. But what we do know is that COVID is nasty. It's really nasty. Right. And there's the obvious stuff like being on a ventilator, but then there's those long-term survivors that are having all sorts of stuff that we're just now seeing, and we'll probably see more in the future. So, if I were a gambling man, I'd put my money on the vaccine, but that's my soapbox. So my question about the variant, my understanding about variants is it's sort of like Darwinism, in that as viruses spread, each time they leap from person to person, there's an opportunity for a new variant, and the survival of the fittest, the ones that tend to pick up steam and thrive in a population, are the strongest, right? The ones that are most that have the greatest ability to survive. And so the more we let transmission happen, it's not the weakling strains of the virus that survive. It's the ones that are like Arnold Schwarzenegger's Terminator version of the virus. That's the scientific term, by the way.
Yes, it is.
Do I have that correct? That it's not likely that the next one after the Delta variant is going to be weaker than the Delta variant, that it will almost certainly be stronger?
Right, that's exactly right. And and one of my concerns is we've sort of let the cat out of the bag. Like, now we're sort of playing catch up. If we had met that sort of timeline deadline of July, 70% vaccinated across the country, we'd be in a better place than we are right now. And, we're going to have a rough fall and potentially winter as it is. But as you're saying, there could be even worse variants that come from having it out there, and every time the virus goes from one person to the next, it changes a minuscule amount until it has changed so much that it becomes a new variant. And as you're saying, the variants that survive are the ones that are strongest, not weakest.
Well, let's talk about side effects. There's the ones we know about, like I got Moderna, and I was among the first that wasn't a medical. I got on a wait list for the leftover vaccine. So I was excited to get it. I would have been in the clinical study. I'm a big fan of vaccines, and I can talk about why that is if you'd like. But the important thing is I got Moderna, and I felt mildly icky, like wanted to stay in bed and be lazy and watch Netflix. But to be fair, I probably would have done that anyway.
Wait, Darren, with the
Just
first
kidding.
one you did, or just with the second? Or
With both of them.
Yeah.
Both of them were a little bit different, but I definitely knew something had happened. And if I had not gotten the vaccine and had the symptoms I had, I probably would have been calling my doctor saying, oh shit, I better get a COVID test. But it was manageable. It was a day or two at most of feeling just a little not optimal, but nothing I couldn't handle. And have had nothing since. And I think that's a pretty common experience. Yes. But then you can speak to, I'm just going to tick off a few that I hear constantly. There's the real crazy stuff like it makes you magnetic and it changes your DNA and all of that. But then there's like what I would say is a more reasonable level of concern to the layperson, which is the fertility question. The autism one is such crap, but you can speak to it because it's a virulent strain of ignorance. I just hear this so much. And now I'm hearing other autoimmune diseases like MS and not Parkinson's, but MS and Crohn's disease, stuff like that. So just in general, what are some of the known potential risks of taking the vaccine that are legitimate, that are real things that could happen to a small percentage of the population? And what is just people on the internet spouting off whatever and it has no merit whatsoever?
Yeah, well, I mean, the vast majority of people experience what you did, which with the first shot, they may feel, pain at the site. If they have had COVID at some point, they may have somewhat stronger symptoms like the fatigue and a mild fever. Usually those types of things don't come until the second shot. And if you plan for it, right, I mean, if you're prepared for it and you're in a position where you can take a day or two off, that's ideal. I mean, in terms of people who aren't able to take that time off, there have been a lot of systems and, the government trying to encourage employers to give people that time off to support them in order to be able to go take the vaccine. So that's the vast majority. The other things that you're talking about, I mean, sort of autism predates this sort of false narrative about vaccines being associated with autism definitely predates COVID. I mean, there is as well as I do, a large group of people, or a group of people who believe that there's a connection for any types of vaccines and autism. There is not. It's never been shown. It's never been proven. It's been looked at and evaluated and studied left, right, and center, and there is no association. We've not seen any issue giving the vaccine to pregnant women or women who are hoping to become pregnant. Some of the things that we have seen, like with the J&J vaccine, which tends to happen more to women of childbearing years, 18 to 45 or 50. We have seen some rare reactions, which is why now that particular vaccine comes with a warning for women in that age group. And to be honest, with people that I encounter, if you are female and you're within that age range, I recommend you get Moderna or Pfizer. The only contraindications with Moderna and Pfizer are that if you have a true allergy to like polyethylene glycol, which most people don't even know whether they have that or not, the only way you would know is if you've had a colonoscopy and the stuff that you drink to prep for a colonoscopy. If you've had a true allergic reaction, I mean, everybody has a negative reaction to the stuff you drink before colonoscopy. It's not pleasant. Everybody has, because it's designed to empty your system, so everybody has diarrhea and GI stuff.
You put it so delicately.
Well, but if you have a true allergy to that, then you cannot take the Moderna vaccine, and you can take the Pfizer or the J&J instead. So yeah,
Well, can I ask you a question? I
yeah,
walked in and got Moderna stuck in my arm, and no one asked me if I had an allergy to that. And
yeah,
and like you said, unless you've had a colonoscopy where you had to drink whatever it is, how would you even know? So if they're
exactly.
just
Yeah.
doing this randomly to, I mean, should they be checking this first? Is this something that doctors, like general practitioners, should? I don't know. You know the skin prick test where they prick your skin, and if it causes a reaction, not to take that drug or eat that peanut or whatever. Or
Well, we don't have the capacity really to test everybody in advance. But truthfully, when I vaccinate or I'm at a vaccination center, I do have people ask that question. You always get the double take, like, why are you asking me if I've had a colonoscopy in my lifetime? Even that, though, Darren, it's so insanely rare, right? Like a true allergy to the Go Lightly or the stuff that you drink in advance of a colonoscopy. It's so rare. I actually had one through all of this. I mean, and I've probably vaccinated or overseen other people vaccinating thousands. I mean, one center I worked
yeah,
in, we did 20,000
well,
in a few months, and I had one person
yeah,
in all of that who had a true allergy to. And to be honest, she had
yeah,
already gotten her first dose of the Moderna, and she didn't react to it. So
yeah,
the question at that time, they are looking at whether you can mix and match vaccines, but at that point we didn't know. If she's had Moderna,
yeah.
can she get her second dose as Pfizer? We didn't know. So I did actually give her the Moderna and then just watched her much longer. But I actually think it should be a standard
It would be a pretty
question.
immediate reaction if you had it,
It's a pretty immediate reaction. Exactly.
like within an
Exactly.
hour.
Yeah, exactly. So, you'd
Yeah.
get sort of a typical anaphylactic
Yeah.
reaction, shortness of breath, chest
Okay.
tightness. Yeah, yeah.
I would just play devil's advocate with this. I think it's
Okay.
exceedingly rare that I'm going to die in a plane crash, but I still have to watch those awful videos and have a flight attendant teach me how to buckle a seatbelt every time I fly. So,
That's a
just
good
putting it
point.
out there.
No, that's a really good point. I mean, that's a good point. Although, yeah, yeah. I
And
mean,
it's
there's lots
exceedingly
of
rare unless
things.
you're the one who's affected by it, right?
Right. And then it doesn't,
Yeah.
and then exactly, then it doesn't matter.
Then it
But
feels like the most important thing in the world.
right, then it right. But
Yeah.
the truth is, I mean, that example, like so many, there's many things that we do for public health. We don't smoke near other people because now we know that secondhand smoke impacts their health, right? Like so,
Yeah.
we wear seatbelts, not well, mostly to protect ourselves, but we don't people, we don't allow people to drive drunk, not only because they would, hurt or potentially kill themselves, but they'd hurt and potentially kill others. So there's many things across the
Yeah.
board that we do for the public good. And then just sort of going back to what we were talking about, when it isn't just for others, it is also for ourselves, because you're protecting
Yeah.
yourself and you're preventing this, the continual cycle of new variants, stronger variants, worse variants.
Yeah.
So,
Well,
yeah,
this is me getting a little political here, but we talk about the Bill of Rights, but Americans are really good at remembering their right to free speech or their right to worship as they choose or whatever. They're not so good at remembering the responsibility part of that. With every
yeah,
right comes a equal responsibility. And I think that just as you're not allowed to yell fire in a crowded theater, you can't use speech like hate speech to incite a mob.
right,
I'm not thinking of any particular former president when I say that. But I do think that, yes, you do have the right to choose what medical care you get, or if you get it at all. I believe in that. But that right bumps up against my right to send my son to school and feel safe doing so, or my right to make a living as a yoga teacher and not go bankrupt because there's a pandemic raging in my community
right,
when there doesn't need to be.
right.
So there's sort of, I get both sides, but I think we really need to take a heavy look at the responsibility side, that I am my brother and sister's keeper.
Yeah.
And this is not just for me.
Yeah.
It's like when you're pregnant, you're eating for two. When you're getting vaccinated, you're getting vaccinated for like 300 million people in the United States and 6 billion or whatever it is now around the world.
Yeah. Well, I think that
anyway,
again, well, but
soapbox.
no, but that's the piece that makes me sad. And that's the piece that I think for, the community that you're speaking to through Living Yoga that's the piece that confuses me, because in general, it's a world that is empathic, is kind, is caring, believes in kind of health that spreads, right? That isn't just about you. It's sort of about the health of others and the health of the planet and the health. So that's the piece that sort of confuses me. And can I ask you a question, Darren? Like, are people, when it's required to have vaccination, right? Like for schools, right? Like the measles, mumps, rubella, or anything else. Do people just go ahead and do it? What are people going to do if it becomes required? In many schools, many universities, private and public, are requiring the vaccine at this point. So what are people going to choose to do then?
I don't know what they will do. I can speak to my yoga class, which I can't control what public schools do and how they require or encourage vaccines. For me, it's a joint relationship between me and the studio or me and Grace Cathedral. So it's not my decision alone. But left to me alone, I would, as soon as proof of vaccination becomes easy to do and certifiable, in other words, like you can't buy a card off the internet, but I will absolutely have no compunction about saying, you have the right not to be vaccinated. I have the right not to let you into my yoga class. Right. And we'll have to agree to disagree. Either you get vaccinated or you don't come in. Right. And if you have a problem with that, I'm sure there's other yoga teachers that will gladly accommodate you. I am not one of them.
Yeah.
My job as a yoga teacher is, I hammer this home over and over again with the teachers I train. Your first responsibility is that people are safe, right? You can take them to these deep places in yoga, but your first responsibility is their safety, their emotional, psychological, and physical safety. Right. I would not let you practice in my yoga class if you had an untreated heart condition, or if you came in with like Ebola or something. You know what I mean? Like my job is to keep everybody as safe as I possibly can, knowing that I'm imperfect. So I have no problem at all with it. And again, go practice somewhere else. You're not doing it with me.
Yeah. The emphasis being on community and But what do you think it's going to take? Like, what's it going to take to, sort of, anyway, I was sort of thinking about it in terms of where I started, where like integrative medicine, the whole sort of concept is based on looking at evidence, and maybe looking at evidence in a unique way, since a lot of sort of practices that fall in the category of complementary and alternative medicine, you can't study in the sort of traditional way. Like, you can't say like, oh, you do this and this person gets a placebo. Like, you can't. So there is cumulative evidence. People tell stories about what worked for them, what helped them, so it's not dissimilar, right? Like, it's so so it's like, to me, the evidence is there.
Go ahead. I believe that the evidence is there, but I also believe that people, like you and I speak English as a language, but then each sub-community has its own language that it speaks, its own way of communicating, right? Whether it's the Black community, the Latino community, the yoga community, there's certain things that you say within that community that community gets and understands, these shared values and experiences. And I think that when someone like Dr. Fauci gets on TV and talks as a clinician or as a researcher, he's exceptionally good at taking complex things and making them understandable even to imbeciles like me. But I think that what we really need is influential people within each community to explain why getting the vaccine is consistent with the values of that community, right? So I am not a good person to do that in, say, the Black or Latino community, because I am neither Black nor Latino. But I am a yoga teacher, and I do have a following. And to explain to people why being vaccinated is consistent with yoga, the values that we espouse in yoga, and here's why. I could go point by point, you know, why, you know, just even the assumption that you think you know something, like that you think that because Pfizer has done some untoward things, that everything they've done is bad. Well, I've done untoward things. Oh my God, you've known me for 25, 26 years. You could probably start telling people about the untoward things I've done.
Yeah, I'm not going to do that because you could do the same, Darren. So, yeah, we're not going to go there right now. But yeah,
we could ruin each other's careers
exactly in about 10 seconds. No. I mean, I think being fallible is part of it, right? Like, I think that's part of all of it, right? But exactly, it's like, principle by principle, you could break it down. The things we've talked about, like community, like, you know, about connection, about sort of interconnection between beings, about taking what evidence you know. I mean, to me, integrative health is about taking the best of all. You know, not blindly, not without questioning, not without sort of researching and understanding. Well, then the other thing, when you were just saying about influencers, another sort of piece that has made me sad is there are influencers in the kind of yoga, holistic health world that have gone the opposite direction and, you know, sort of merged with this sort of magical conspiratorial type of thinking. Like there was, you know, this hashtag of great awakenings circulating. Are you familiar with that? Like, where was the sense? I mean, I'm not sure what that even means. What does that mean? Like, let everybody die? Like, we're going to just let this virus sort of consume all of us? Like, and then what? And then what?
Well, I mean, the other thing I hear a lot of people, I would like to speak to that in the yoga world specifically, but I would also say that an overarching thing that I see with all conspiracy theories is this, like an example would be like 100% of the people who get the COVID-19 vaccine will eventually die someday. You know, it's like such, like, no shit. You know, but people like, oh my God, this is dangerous. And you hear this over and over and over again. But I would say at the heart of yoga and all contemplative practice, not just yoga, but certainly yoga, is the self-inquiry to say, how do I know what I know? Right? When you sit on that meditation cushion, when you move your body through yoga, you have beliefs that you're bringing with you. You're having past experiences and a narrative that is frequently not helpful to you. Not just around vaccines, but around every facet of your life, your relationships, your work, your body, your health, your body's abilities or lack of abilities. And so when we come to the yoga mat, we try to be scientists. We try to do that double-blind experiment while being I always say we're both wearing the lab coat and we're the guinea pig in yoga. But at the heart of it is, how do I know what I know? And if you have concerns about the vaccine or questions about COVID-19 and you think you know something about it, a good scientist would say, how do I know this to be true? And what do I do when additional data is presented to me? Right? And a good yogi is doing the exact same thing. I believe that we should question authority. I believe we should question pharmaceutical companies that say, take this drug because I said so, and I put a fancy ad behind it. But that doesn't mean it's all wrong. Asking the question is a good thing, but getting your answers from a YouTube video is not.
Right.
including
Right.
if it's one of my YouTube videos.
Well, it's
Right?
it's
What do I know about vaccines,
well, you
right?
just made. I mean, again, you made some really excellent points in that. Within what you just said, which is, one is like know your sources, and the other is understand your own biases. Like understand sort of, what you're bringing to the equation. Why is one thing resonating with you and something else isn't, right? Like sort of before you sort of hit send or like or reshare or whatever, or know the
Yeah.
sources, know when it was written, know and understand why you are responding to it in the way that you are, right? Like,
Yeah.
yeah.
Well, the other thing about yoga and about like just being an online citizen is in yoga, we try to honor the lizard brain, but elevate stuff with the use of the breath. I could get into how it works, but connecting the dots between the lizard brain, that emotional, guttural thing that makes you hit like or reshare,
Yeah. Yeah.
and connect it to the upper brain, the upstairs brain, the logical, critical thinking brain that says, wait a minute, is it likely that this is true? How do I know this is true? Can I get additional information? If this sounds concerning to me, should I go Google it or should I go ask my doctor, who I trust? and it's that hitting that pause button long enough to step back and say, how do I know what I know? Is this just me feeling something powerful?
Yeah.
And it's okay if you feel that. Just go investigate it more, much more.
Well, and also we're talking about like the through line, the thread between the two, because compassion and care, like for yourself and for, your loved ones and families and community, and even for people you don't know, we're sort of asking to bring the two together, the heart and the mind, because, so it's not sort of the knee-jerk feeling, it's that like broader, feeling of heart and compassion. And in truth, they do, like in my mind, the solution brings together both. It brings together the logical thinking mind with the compassion and caring. Otherwise we kind of let the virus win instead of us, like instead of humanity.
Well, I want to give you the opportunity in just a moment to say anything you think we didn't get to that you think is really important. I do want to say something to the people listening to or watching this, and that is I welcome your comments. I welcome dissenting points of view. But what I do not welcome, and what I will delete from anywhere I can find it on my social media, is disinformation. If you want to post something to a reputable medical source, go for it. If you have a question or concern, post it. But if you're posting disinformation, I will absolutely delete it immediately as soon as I can get to it. So please ask questions. I will put some resources, Jacki. You may have some resources, and I can add to that, where people can get good, solid information so that they can make an informed choice for themselves. But don't post disinformation on my social media because I will delete it. How's that? How's that for being a hard ass, Jacki?
No. It's being honest. It's being frank. It's like you're protecting yourself and others. So that's awesome. But
So open mic night for Jacki. Are you going to do like a Carly Simon song cover or something?
Yeah, no, you really don't want me to do that. Trust me. No, I feel like we've hit a lot. One thing that we didn't address directly is sort of this whole idea of, it altering your DNA. Does not. I mean, I think of it as... No. I mean, it's called an mRNA vaccine because it's almost like a blueprint, right? It's almost like directions for your immune system to respond to the vaccine. But I was thinking about it, honestly, I was thinking about it in the context of that is what lifestyle medicine is, Darren. Like, our intent when we talk about nutrition and physical activity and stress reduction and, social connection, when we talk about all of those things, we're actually looking at how you change your genetic expression and how you change. It's not changing your genetic makeup, but it is changing how you express those genes that you have. So it's just interesting to me because people are so frightened by the idea that an mRNA vaccine, just because it holds that name of genetic material, could change your. It doesn't, and B, actually, when we're sort of promoting things for health, we are actually changing genetic expression so you stay healthier for a longer period of time.
Yeah.
Yeah. The other thing I was thinking, the other thing I guess I was thinking about in terms of big pharma and.
Yeah.
And I've never worked in that world. I've never had any desire to work in that world. I've never even had a desire to, to work in any kind of corporate setting, including I do, some peripheral work in academic centers, but I've never, enjoyed it, liked it, been drawn to it. I've always been suspect of it. But in truth, in this case, the fact that we have those resources available is not just helping our country, it's helping the global, it's helping the global community, because as we develop these vaccines and disseminate them worldwide, we're doing some really great, so-called pharmaceutical, big pharma is doing some really great things to make that all happen. So like a lot of things we're talking about, not everything is black and white. There are positives and negatives to take from, all entities, I guess, all institutions.
I don't know if I've ever told you this, Jackie, but I'm going to say it here publicly because I think it's important and it's relevant to this. Jackie backs up. No, I trust you perhaps more than any other person on the planet, or maybe my mom. My mom has always been there for me too. No, we've known each other for so long, and there's been numerous times when I've had a medical issue where I felt like I needed a second opinion, and I've always called you because I know you share my sensibilities around being as natural as possible, but also that there's a time and a place for a pill. And as many viewers, listeners know, I'm HIV positive, long term. And when I first tested positive, the drugs that were available were not particularly pleasant. They came with tons of side effects. And I think there was an assumption, and quite possibly borne out by the facts, that some of those drugs actually killed people. And so when I tested positive, I had no interest. I was really clear that I never wanted to take it. I wanted to do it naturally. And I lived for 6 years naturally without taking any drugs, with relatively few health consequences. And then my health started to decline, and I started to get what I would call lower grade opportunistic infections, things like oral thrush, things that weren't particularly life-threatening, but that were not normal for a healthy 30-something guy to be getting without, chemotherapy or something. So you were one of the people I talked to, and it was because of you not judging me, but just calmly talking to me about my choices and just like creating space where I could come to my own answers. And I started taking meds, and I'm so glad I did, because I'm alive today to be having this conversation with you. Mm-hmm. And so much of what I learned back then online was bullshit. It was not real. It was understandable, and it played on my fears of those medications, which were not perfect by any means, the early meds. But it was you not judging me and speaking to me as a doctor and as a friend that helped me to make better choices. So my hope in this conversation we've had is that people have not felt judged, and that we understand why you are hesitant, but get the answers, get the information, because I would likely be dead today if it weren't for the patience of doctors like Dr. Jacki. Yay! How you doing, Jacki?
Darren. I'm good. Thank you, Darren. I mean, your story is you take the best of both worlds, right? I mean, allopathic medicine isn't perfect. So-called alternative health isn't perfect. You take the best of all, and you evaluate the information and the evidence, and you bring it together.
Yeah.
So
well,
thank goodness you did all that you did in every direction. Yeah, thank goodness. Yeah.
I've lived at least another decade just to annoy you.
Not at all. Maybe Jaden, but you don't annoy me.
Yes, definitely Jaden.
Yeah, in a good way. In only a good way.
When they come out with a vaccine to make me into the cool dad I envisioned myself being when I became a father, and not the dorky, nerdy, pain in the neck dad that I am reminded I am every day, that will be a miracle of something.
Yeah, forget it. It won't happen. Yeah, it's like we're all the progressive commercial. So.
Well, my friend, if people want to reach out to you, I know you're doing a lot of work to educate people right now. Is there a good way for people to reach out to you or your organization with questions or?
Yeah, I mean,
I know you're doing some YouTube videos and stuff as well.
Well, one site that we set up is called COVID-recovery.org. There's you can actually ask questions through that site, and they will eventually come to me. They go to one or two other people, and then they come to me. But the site really tells people's stories. So on all things related to the pandemic, not just medical things. So that's probably where I would tell people to go, covid-recovery.org.
Well, I can say if you have hateful, ignorant emails to send, you can send them to me. I have thicker skin, and you can send your legitimate questions to Jacki, and we will post her website in the show notes so that you have easy access to that, along with some additional information so that you can make informed decisions about COVID and other stuff as well. Jacki, you're amazing, and I can't wait to see you in person again. It's been way too long. Thank you, COVID, for taking Jacki and turning into a Zoom friend.
I know. I'm looking forward to seeing you in person, too. Thank you for doing this. I just feel like any individual we touch makes a difference. And, thank you for doing this.
Awesome.
Bye.
Hold on. I'm going to...